Okay. Now, can you hear me?
I can hear you now.
Okay, good. All right. Thank you for joining us. I think we got a press release from somebody publicizing what you're doing. Welcome. Is it Lana,
Thanks.
is it Lanai?
Hi, good morning. It's Lonnie.
Lonnie. Okay, all right. I
Lonnie.
had to guess here. All right. Lonnie is sitting in, substituting for Dr. Trin, who's on a plane somewhere this morning here.
Headed to Virginia.
Headed to Virginia. Why is he going to Virginia? Well actually,
You know,
save that. We'll talk about it here. All right. All right. Well, thanks this morning. So we're going to talk about mental health, right? Is that right, Dr. Christo? During the COVID?
Sure. What, opioid overdoses, pain, and so on, I'm assuming?
Exactly. Right. Exactly.
Okay.
And just remind me, because I don't have the notes in front of me, was this a book that you wrote on this or a paper or
I
something?
have written a book. It's called Aches and Gains,
Okay. All
on
right.
pain, on overcoming pain.
Okay. All right. Well, we'll talk about that because I think a lot of people are in pain today here, particularly during the COVID lockdown here. So.
Yeah,
All
yeah,
right,
true.
everybody stay quiet for a moment here, and I'll sort of guide the discussion. I'll be sort of like the narrator here, and Lanii, why do I want to
Lonnie.
say Lanai? Lanii will join in and ask some questions, and we'll have a good debate here and discussion for our group this morning. So hang on, we'll get everybody on in just a minute. We're on Facebook right now. We get you on. Let's get everybody on YouTube here. Okay, so everybody just stay quiet for a couple minutes and we'll get this thing rolling. Hang on. Hey, welcome back, everybody. It's time once again for another episode of Health Talks with Dr. Trin. The one show, maybe the only show that shows you how to live a healthier life and to handle everything that's being thrown at us today. We're going to talk about that in detail. COVID is certainly causing a lot of craziness, and we've got some, well, maybe not crazy people. Maybe I'm the only crazy person on this morning here, but we have a couple other people joining us to talk about the crazy things happening during COVID and the crazy ways it's making us all feel here. So let me introduce, first of all, Dr. Trin, as you'll notice, is not here unless he has decided to change his hairstyle this morning. Lonnie is substituting for him because Dr. Trin is where, Lonnie? Dr. Trin's on a plane somewhere.
He is. He's headed to Virginia. I'm not quite sure why, though.
Okay. I didn't know. Does he have family there or business there? I don't know. We'll find out when he gets back why he went to Virginia this morning here. So introduce yourself to our audience. You haven't been here before. Lonnie, he asked you to step in and kind of help me shepherd this discussion this morning. We'll bring our guest in a moment, but let's introduce you to the audience here, Lonnie.
Great. Thank you so much, Paul. Well, I'm Lanii Phan. A little bit of my experience and how I met Dr. Trin is through healthcare. I'm currently over at 360 Clinic, which is a COVID testing company. And we're
Yes.
quite very well known in the Orange County area, more so of our super sites at OC Fairgrounds and Anaheim Convention Center. So that's how Dr. Trin and I, we got a chance to kind of work together. And of course, last minute, which Dr. Trin.
He's good at that. He just says, come
Well,
on, you can do this here. Yeah, come on in. All right. Well, we're going to talk about the state of COVID here today in Orange County, and that's part of the discussion we'll have today here. But let's bring in our guest who's coming to us from all the way across the country, Dr. Paul Christo, who is a professor, are you a professor? You teach at Johns Hopkins? Do I have that correct here?
Yeah, associate professor. Not a professor quite yet, but associate professor.
Well, after today's talk, they're going to elevate you here for sure.
They will.
That's
I hope so.
absolutely going to happen here. And Dr. Christo joins us. So Johns Hopkins, you're actually at Johns Hopkins, which, if memory serves correct, is in Baltimore. Is that where Johns Hopkins University?
That's right. It's in Baltimore, Maryland.
Okay. And obviously a very well-known hospital and university. Tell us what brings you here this morning. I remember we something crossed our desk that you'd written a book, and why don't you describe the book and your background, and then we'll launch into the discussion here.
Well, I'm a pain specialist and I'm an anesthesiologist in academic medicine. And actually, I also host a radio show on overcoming pain called Aches and Gains.
That was it.
And
We thought you're an expert to come on our radio show here this morning.
and that's the name of the book, too, that I wrote a couple of years ago, Aches and Gains, about overcoming your pain and different ways to do that, traditional methods of doing that, integrative methods of doing that, and then also innovative methods of reducing pain, chronic pain.
So not aches and pains like we would expect with a P, but aches and gains with a G. Is there any way to gain? There must be, but I don't really know many. And I'll preface it by saying that my late mother, who we've talked about in the show a few times here, who died a number of years ago, spent the last years of her life in miserable pain. She had Parkinson's, she had fallen, she had other things going on, and it was, for a woman who lived life fully and was always laughing, we're all good Irishmen, she loved to laugh and have a good time. She had a miserable time the last 10 years of life. Really was horrible to watch. And by the end, when she'd been in the hospital umpteen million times with problems and stuff, it was almost a relief I know it was a relief for her, and I hate to say it was a relief for us to see her go and to stop suffering here. I suspect there are many people who are similarly ensnared in pain. Talk about that a little bit, and what hope do we have for that?
Well, the reason you described is in part why I wrote the book, because I think that there are treatments that can ease pain and suffering and make life tolerable for those who have chronic pain, and certainly at the end of life. Even cancer patients who have pain have high percentages of intense pain that isn't controlled. And I think that it should be. And this is why I wrote the book, and this is what I do for a living. That is to try to come up with good methods of reducing pain, not necessarily stopping it altogether. It's hard to stop it altogether and to provide, 100% pain relief. But I do feel like we have ways of reducing pain to make life meaningful for those who suffer from pain.
Well, I'm also reminded of my late uncle who died many years ago of a horrible cancer. I can't remember which one it was, but I remember seeing him after a year of suffering, and he took me aside, and he literally, this is shocking, but he literally took me aside and said, "Kill me, put me out of my misery." And I'm like, oh my God, I'm not going to die. I'm not going to sit here and listen to. That's how horrible he felt at the time here. So the typical answer has been, for years, and this is not a shock to anybody. It won't be a shock to Lanii. It won't be a shock to our listeners here. The typical answer has been, drug them. And we've come up with incredibly powerful drugs which have incredibly bad side effects to people and make them drug zombies, like my mother was. For when she wasn't in pain, she was a drug zombie with things like opiates. How did we come up with this as the catch-all, that we're just going to pass these out like candy and relieve everybody's pain, and that's the answer? How did we get there, and why isn't that working?
About 20 years ago, we had this interest in treating pain that we didn't have before.
Right.
In the past, many years ago, we used opioids primarily for cancer pain and at the end of life. Then there was a renewed interest, understanding in the mechanisms related to chronic pain, and that a lot of people shouldn't be suffering. And what happened was that a lot of sort of frontline providers, physicians, other healthcare providers, started using opioids for pain control, when in fact they probably shouldn't have. In other words, they were using opioids as a first-line medication for pain control. Typically, we use opioids, and they can be very helpful, but we use them after other medications or after other therapies, interventions, injections, you name it, don't help enough.
I always got the feeling that opioids were the last resort. They're addictive, they're all these things, but what else? Somebody's like my uncle screaming in pain. Better to take them out of that pain than to watch them suffer, because we don't believe in the society in assisted suicide for the most part and ending their life, even though there doesn't seem to be any other answer. So we try and make them as comfortable as we can for whatever time remains. But that has morphed into, hey, let's give these out like candy. And I don't think I'm saying anything shocking to people, but there have been numerous reports. There are tons of people addicted to opioids, particularly in the middle parts of the country. where hope has been lost and people have passed these pain pills out for other things other than end-of-life pain control. Talk about how opiates spun out of control, how doctors started, and I'll preface it by saying some of the stuff I've read, and you can confirm this or not, but doctors in med schools, like, I'm not saying your school, but schools like yours, we're telling doctors, hey, there's no side effects. This is like candy. Give this stuff out. The manufacturers were saying there's no big deal, and the doctors were passing them out like they're no big deal, and suddenly it is a big deal. How did we move from end-of-life pain control with opiates to the opioid crisis that we're facing in this country, where so many people are addicted?
Well, I think it started in good faith, to be honest with you. So I think that the physicians, other healthcare providers that were giving opioids were doing it to control pain. I mean, pain is a major problem in the United States. Over 100 million people suffer from chronic pain in the US alone. And worldwide, it's something like 1.5 billion. So, we have a true problem here. What happened is that some of the pharmaceutical companies started advertising and pushing, I think, physicians to use opioids more frequently.
Right.
And we had this renewed interest in treating pain. We had the Joint Commission. This is a commission that accredits healthcare facilities in the country, say, hey, pain is now the fifth vital sign. We need to assess it. We need to treat it. So there was sort of an overexuberance, I think, of treating pain. Right. And opioids at that time were the first line agent to treat it.
And why this is, again, I don't know if I'm overstating this, but there have been massive lawsuits. The company, I forgot the name of the company, I know that was the largest supplier of opiates, has
Purdue.
been, yes, and they've been sued, and I don't know if they're gone bankrupt, but they've all sorts of ways to move money around, and people are saying, you created a misbelief in the power of these things and overstated or created an impression there was no problem with them, so pass them out, and therefore they misled people.
I think some of that is true. I do. I think some of that is true. On the other hand, what we've learned too over time is that a lot of what we were seeing at that time was also related to the non-medical use of opioids.
Yeah.
In other words, it wasn't legitimate pain patients, that were using opioids who were misusing them. That's true to a certain extent. But a lot of the time, it was related to other people who were getting access to those opioids, friends, family members, for example, who were using them when they weren't prescribed to them and overdosing and dying.
Yeah, right. Okay, I'm going to bring Lanii back in a minute here, but I just want to flesh out the problem for the discussion this morning here. So we started with an understanding a long time ago that pain was unmanageable. And somebody told this to me, I don't know, maybe I'm overstating it again, but, Western medicine is great at intervention. You broke a leg, you need a new heart transplant. But chronic conditions like pain, most doctors kind of shrugged and said, what do you want me to do? You're old, you're sick, you got a problem. And so for a long time, it was just kind of accepted. That's just, I'm sorry, but pain isn't much we could do. Then, as you said, there was a priority pushed on maintenance. This is wrong. We should find a way to manage pain. We should address this. We can't just ignore it and accept that that's just the way it is. So as we did, we had a desire to do it, but the typical way was just give them a pill. Is there anything other than just give them a pill to manage pain? Are there other hopes, or we just got to find a better pill?
Well, no, there certainly are. So we talked about the opioids as a pill, as a pain medication, but
right.
We have other medications that we use. We use anti-epileptic medications actually to help reduce pain. We use certain antidepressant medications to ease pain.
Really?
We use anti-inflammatories, Motrin, for example,
right.
Advil to ease pain.
Right. But are there other therapies being looked at or developed? Is it all just a drug, or are there other ways? I don't know, diet, exercise, massage. People talk, my mother tried everything she could think of. In the end, she did. She went to Eastern medicine, and she did, where you put the pins in everybody here? Lanii, help me out. Acupuncture, yeah. Right.
Yeah. Acupuncture, yeah.
And many times as she went to non-Western medicine, as she tried things like acupuncture that my father, who was so practical, scoffed at and laughed at and said it was all quackery, but she was desperate, and he was too. So they tried all sorts of things. And they came to believe in things like acupuncture and whatnot. Talk about that, Lanii. I know you guys are a COVID clinic and do other things, but in your other practices, is there something to be learned from non-traditional or Western medicine, non-Western medicines about pain control? They seem to have a different view of it and some different ideas about it.
Yes, well, more so of a cultural thing as well too. So my mother is Vietnamese and my dad is Hawaiian. And growing up, my mother, she more so believes in, you know, you do your best not to take any kind of Western medication unless you're just, it's unbearable.
Right.
You know, so for us growing up, every time I had a fever, instead of Motrin or Tylenol to reduce that fever, she does more of, a lot of it has to do with herbs. So she would, and I don't know particular what type, she would go to some of the stores and collect these herbs, and she would pretty much soak them and boil them in hot water. And I remember, to reduce my fever, these herbs kind of just help out with your pores. So you would pretty much kind of take off layers of clothing and just kind of reduce the fever. And then there's this blanket. It may sound a little funny.
I'm just saying, I know I'm not trying to support any of this stuff. I'm just saying people are desperate. And I know that outside of Western medicine, if you go to Asia in particular, they have different options, different beliefs, things like acupuncture, which we may scoff at or not accept. But it seems like there's been more interest in that than ever before.
Right. And so just kind of going back, I would remember this huge pot of just with all kinds of herbs in it with hot water. And we put a blanket over it. No more, I would stay in there no more than 15 minutes. I mean, we would notice the fever, it would reduce within the next hour.
So these are traditional medicines that have been around.
It's traditional medicine,
right?
Correct.
So Dr. Christo, I'm not going to put you on the spot here too much, but I know here you are at the epicenter of, you guys are teaching and researching and whatnot here. Has Western medicine come to, are they more than interested? Is there any, I don't know, support for anything other than our typical approach to intervention to medicines and drugs and stuff? Are we looking at other things like acupuncture and whatnot?
Yeah, definitely we are. And I think that's become more mainstream. I recommend acupuncture to certain sets of patients of mine that I think it will benefit. And we know, if you look at sort of the studies on acupuncture, that it can be helpful for low back pain, for neck pain, for knee pain, for shooting leg pain, for headaches, numerous conditions. I think the struggle we've had that we're trying to overcome now is coverage, insurance coverage for, say, acupuncture for patients. But I have to say, I've seen more insurers cover it, or a certain number of sessions anyway.
So there is a coming together of these two, because Eastern medicine, I'm going out of my depth here, but Eastern medicine has a whole different view of the body and the system. And there are these, what would you call them, Lanii? Help me out. There's sort of pressure points. There is a different view of how the body functions and life flows and energy flows through the body, which traditional Western medicine has scoffed at. So come on, that's just voodoo. That's just ancient ideas here. So
and so also, I mean, it's also a big thing of our intake to our body as well too. Just growing up with my mother, who is just so involved in more obviously our culture, and it's what we eat, how we take care of ourselves, exercise, and a lot of the stuff that we, growing up was a lot of vegetables, a lot of our intake of water that helps for headaches, helps everything, just to flush out any kind of toxin. So that's how So
what's the state of pain medicine, management today, Dr. Christo? Are we just looking for safer drugs? Are we looking for other non-traditional alternatives? Are we exploring something else that I haven't even thought about here? I don't know. There's some sort of ultrasound therapies or something. I can't imagine what other technologies are being explored. Talk about the state of pain management today.
Well, we're exploring all of what you mentioned. So if you look at some of the integrative therapies that we've been talking about, acupuncture, ear acupressure actually is interesting. I don't know if you've heard of this, but I've never heard of it. Study with one of the nurses.
Ear acupressure. Somehow you're putting pressure in some part of your ear here. Okay.
Yeah, you use these sort of small little seeds that you place on certain locations on the ear to relieve pain in certain other areas of the body. We're doing a study actually looking at how it relieves low back pain in older adults, because the ear corresponds, certain portions of the ear correspond to certain parts of the body. So, there is for sure interest in the integrative therapies for pain control. And there's a whole host of what we haven't talked about yet are the injection therapies, the nerve blocks that can be very helpful as well.
Okay, so where do you see the most hope? Well, let's go back a step. Can we all agree that opiates weren't the answer? They had their place. They still have their place for severe end of life, perhaps, or some other things. But by and large, this idea of take a pill and everything will go away, from aspirin and Motrin all the way up to things, I think that's part of the problem. That's my personal view. As a society, we've trained ourselves, if there's a problem, take a pill. And so when people started facing problems like loss of income in the Midwest as jobs dried up and disappeared in towns, people started losing hope and getting depressed, they just take a pill. As people get into COVID, that was ostensibly the purpose of today's discussion. Talk about that. As people lose hope, why are they turning to pills as the answer?
Well, what we saw initially, so if we backtrack, initially we saw overdoses and deaths related to prescription opioids.
Okay.
Then it moved from prescription opioids to heroin. And then over the last couple of years, and certainly during COVID now, we've seen an increase in overdoses and deaths related to synthetic opioids, illegal opioids. Yeah. Fentanyl is the one, unfortunately, we're seeing implicated a lot in death. So to be clear, these are not prescribed opioids for patients. These are opioids people are getting off the street and unfortunately overdosing and dying. This
has gone beyond just drug companies being overzealous to try and sell their products, and doctors perhaps being under either informed wrong or not paying attention enough. Here, take a pill. You got a problem. Go talk to me some other day. Now it's gone beyond that, and we're talking about street illegal drugs. Talk about fentanyl for a moment here. Am I correct that fentanyl was originally created as an elephant tranquilizer or something like that? It had.
I think it is used. You're right, in veterinary medicine. I think it is, but it's been widely used for many years among the anesthesiologists who use it to ease pain during surgery. So we use it intravenously for pain control during surgery and even after surgery too. But we've also used it for chronic pain in different forms. It's very potent. So think of it as like 80 to 100 times more potent than morphine. And that's why it easily kills people.
Wow. Okay, so you've got this powerful drug out there. Why can't we control this? Why is it so widespread and widely available? Is it just money talks and people find a way to do this? Or should we be regulating and controlling this more? I mean, like fentanyl. I guess fentanyl is where? I don't think it's made in this country. It's made in Asia or China, someplace like that. Why can't we just ban it?
Yeah, I mean, good. That's a great question. I mean, a lot of that we've seen come in from China, and it's sold illegally, on the streets. I think the reason that people are turning to drugs right now, and certainly during
I guess that's the bigger question, right?
Yeah, is that, COVID has created an extreme amount of stress and a lack of coping skills. And when that happens, people who have never used drugs before turn to mind and mood altering substances. Could be an opioid, could be alcohol, could be tobacco, but we're seeing a lot of people turning to fentanyl and street drugs to cope.
Well, I find this just amazing that it got spun out of control so easily, and it does seem like it was a multi-layered thing. There were drug manufacturers who made a fortune off of this, who misled the doctors in the world that this was safe and take it and don't worry about it. And then doctors, every special I've ever seen on television says doctors readily overprescribed these things. In the same way that back in the 60s, they were giving everybody, what was it, that drugged all the women and every Valiums and stuff. My mother went through that period where every time she had a problem, the doctor just gave her a Valium. You're just high strung, calm down. Mm-hmm. And suddenly she developed a Valium addiction like other suburban women did at her time. The Valley of the Dolls, they're all drugged out. So we had this kind of dual thing, and then it went beyond that to where it's not just prescription anymore. I'm going to take this for anything and everything. And now we got a new drug coursing through the veins of the country here. causing massive problems. I'll never forget watching in one of these specials about COVID, about the opiate addiction problem a couple years ago, particularly back in the Midwest where I grew up. These small towns have been devastated as they've lost the factory and everybody has lost their livelihood, or the coal mine's been shut down or whatever here. And rather than move, because this is where we've always lived, now people are just suffering and the towns are shrinking and people are turning to drugs because they've lost hope to escape. So in this world, there was an image, this was in Ohio, a picture of a couple, a young couple in their 30s. And their child is in the back seat, 3, 4, 5 years old, something like that. And they found them like this. The parents are in the front seat, dead, because they've both taken an opioid overdose together. And the child doesn't know what's happened. And their parents he thinks mommy and daddy are sleeping. I'm going to get choked up here. And the cops get called as they see this, and the couple's dead, and their kid is in the back seat, not realizing what they witnessed. That's the picture that in your head here. I mean, that's what we're dealing with here. Have we made any, I know the last administration made a big deal about it. Everybody has. Have we made any headway in this? Are we cracking it, or are we just covering it up, doctor, in your opinion? Is opioids still ramping? Did COVID just add another layer to this and it's even more out of control, or have we gotten any control over this?
I think COVID has added to the problem, unfortunately, and we're trying to rein in the problem. We're trying to gain control. The Centers for Disease Control has unfortunately spent some money on collecting data on overdose deaths to better target public health measures to reduce the problem.
So is it better, do we need to crack down on the drug companies? Do we need tighter regulations of overseas stuff flooding in? Do we need more border enforcement? I don't know, to clamp down on illegal stuff coming in. Do we need better education from doctors? Do we need any of that, all of that? What do you think, doctor? I'm going to wave a magic wand and you're going to be our COVID czar, our opiate czar here. What steps would you take?
I think better, certainly, regulation of these illegal drugs that are being manufactured, especially the illegal opioids that we've talked about. Fentanyl is a good one. But we've also seen a fairly precipitous rise and concerning rise in the abuse of stimulants now. For example, methamphetamine is a big one, and cocaine is something else that we're seeing. So we're seeing cocaine along with an opioid together, leading to more and more deaths. I think we need some control over how people are getting access to these illegal drugs.
So Lanii, when the work that you guys do at your clinic, do you ever get into any of this kind of stuff, pain management, drug addiction, this notion that somehow if you got a problem, there's a pill to solve that?
More so, not our COVID testing, but that leads to our telehealth. Just because that's more of the modern kind of healthcare that we're moving towards, where because of COVID, everybody wants to stay home, more so the seniors, where they're fearful of stepping out of their own home. So we have telehealth, which is connected to our COVID testing. So a lot of that is FaceTime. They are there for them if the patient has any questions and starts to kind of express on the pain side of that. There's a physician behind on the other side to kind of help guide them on what to do.
Now here's my fear. Now we're not delving in the realm of facts anymore. This is just fear. My fear is that if you're not physically seeing a doctor, if you're just doing it over the internet, that there's an impulse to just come up with a simple solution, like a pill. You're not feeling good? Let me write a prescription. Next, rather than really, I don't know what a doctor does, touch you, feel you, examine you, whatever, something here, that because there's a limited contact, I'm going to, it's sort of like radio shrinks versus a real shrink, a real psychologist. I'm going to give you a quick answer here. What do you think? Is there a danger of that? Are we in danger of just making the problems worse because we're going to come up with simple solutions because we have limited access to each other?
Well, for my thoughts, I mean, I think it's great to have that as an option for ones that are, not just fearful, but don't have the care or may not even have transportation to get out.
Believe me, I get the whole appeal of thing. It's 2 o'clock in the morning and I am frightened and I have nobody to talk to and I can't get in to see my doctor. And not to say the doctors are spending that much time with you anyway, because I got a clock. Medicare is only, or whatever, Medicare is only paying for so much, or the drug companies are only paying for so much. It becomes more of a factory, and they're moving you in and out faster. That's a common complaint too. So I get the power of it. I just see, again, the potential that it could be misused, where people are just writing prescriptions as a quick antidote for everything.
Right. And this, I mean, personally, I think this kind of goes back to where regulations or more educational for everyone, physicians, mid-level, just anybody who's in the healthcare that's being able to provide this as an option for patients. So, I mean, I think it's great that we're just so used to the way of picking up the phone. If I'm not feeling very well, make an appointment, physically go for your appointment. But I think for telehealth, telemedicine, is that it's great that if we educate ourselves on being more available on a timely manner, to provide that for the patients that's home. And that kind of goes back to, it narrows down to education on how we can be more patient and what we can do for the patients, the one in need.
So does it really come down to that, Dr. Christo? Is it educating the population to changing their expectations? Because it isn't just the doctors, it's the people who think, I got a problem. I've said this for a long time. We live in a instant gratification society. I got a problem. I want an instant answer. And if I can't get it from you, I'll get it from somebody else.
Yes, and you're right. Certainly in other cultures and other parts of the world, that's not the expectation. I mean, they do accept pain to a greater degree than I think Americans do. And to go back to what Lanii was saying, I think telehealth, telemental health services have really been advantageous for those who are abusing medications or who are in the throes of addiction, because frankly, it really wasn't available much before COVID. And I think that's one positive outcome of having of COVID-19, that is, we've got greater use of telemental health services. And I think it's helped patients connect with psychologists, connect with therapists, connect with counselors, psychiatrists, support groups, and that's critical.
Well, we've had some comments I've been ignoring here. I apologize. Let's bring in some of the audience here. Dan Daly's here with us again. Thank you, sir, for joining us, as well as Helen. And everybody seems to be quietly listening. And the couple of comments so far is, COVID has generated a lot of fear, as Dan Daly says. People faced with fear will self-medicate. Booze went up. Drugs went up. Suicide went up. Whatever it is, I can't take it. I got to have an answer. Why are we, I don't know, is this the way of the world? Does everybody act like this? Or do we need to toughen up, or change our expectations? I'm not, toughen up's a horrible word, but somehow not expect instant answers for everything.
Yeah, I mean, I would agree with that. I think that it's sort of, I mean, what you're touching on, I think, is something that's pervasive in the United States. And it's, unfortunately, I think there are a lot of people who are stressed, unhappy, and who need better ways of coping with stress. And I think that's what's lacking. I think, Lanii mentioned education earlier. I completely agree.
I think of the immigrants. We're all children of immigrants at some level. Very few of us are Native Americans here. And the immigrant struggles. I listened to the boat people come over from Vietnam. These are tough stories. Their first impulse wasn't to take a pill or take a drink or drown themselves. I'm not saying some didn't, but there was a tougher attitude towards tough times. And I think of the Great Depression that my own father went through, and his immigrant who came over on boats and cattle cars. And I don't know, where did we change along the way that we suddenly want instant gratification, instant answers, and easy answers for everything? I'll throw this out to Dr. Christo. Is that part of the education from top to bottom? We just need to take a look at how we're approaching stress and difficult times?
For sure. And I think, generationally, this is what we're seeing now that didn't exist before. My parents, your parents, and so on, I think had completely different expectations of how to deal with stress and anxiety and pain. And with the new generations, it's a very instant type of fix. I mean, look at my kids too, they're focused on, and we have to restrict access to the video devices, right? iPhone, iPad, all the screens, and it's there, it's quick, and it's instant. And I think that we have to sort of step back and say, well, okay, wait a minute now. This isn't something that's going to probably help you in the long run.
So in your book, give us a preview. We've danced around it here. Aches and gains. Give us the aches you're seeing and the gains that people are making.
Well, I came up with that title because there are a lot of people who suffer from pain, and it's unfortunately usually not well controlled,
right,
and undertreated and untreated. And the gains are that we have something to do about it. That's why that's the title, because there are things we can do. And so we talked about some of them, the pharmacological strategies, the medications that are not necessarily opioids, but then we have a whole host of injection therapies that are helpful, nerve blocks, injection into joints. We even have these devices now that use small doses of current to reduce pain.
Talk about some of those, because I never hear much of that. Do you see any of that, Lanii, in any of the stuff that you're dealing with? Is it all
No,
just still
I'm definitely interested. And I love the title of the book, by the way. I need to pick myself. I need to get one today.
Aches and gains, because there's hope here. All right, so let's start with nerve blockers and stuff. I mean, they do that in childbirth. That's about the only time we're in surgery. You take a nerve block. And I remember my daughter, she has 2 children now. We were there when they were born. And, she kind of waited and waited. She was hesitant to take a nerve block. You're supposed to feel the pain and go through childbirth, but boy, it got bad. And she called for the nerve block fast, and magic things happened. And it didn't seem to be any lasting side effects. She wasn't addicted to something afterwards. Talk about nerve blocks first, and then we'll talk about some of the other ones.
Well, I mean, if you have a certain type of pain that's in a nerve distribution, it may be down your arm, it may be down your leg, it may be across the chest, we can target those nerves with local anesthetic and a little bit of steroid and place a needle along where the nerve is, usually under some type of image guidance or x-ray guidance. And so deposit the medication around the nerve for pain control. It often has to be repeated, so it's not usually, unfortunately, a one-time and you're cured.
Right.
It often does have to be repeated, but the interval can be long, and it does help restore a semblance of normal life in patients who are completely debilitated by, say, nerve pain.
Did they ever sever the pain nerve? They tried that in my mother in desperation, and it actually didn't turn out well. She actually had a car accident too, on top of everything else, and so she had chronic pain because of that, kind of a whiplash thing, then neck pain and everything. And in desperation, they severed one of her nerves. I thought that was horrendous. I don't know that really helped or worked, but
usually it doesn't help. I mean, it's rare that, say, the neurosurgeons would cut a nerve because it can lead to chronic pain, unfortunately. Like I had a patient, for example, this is a quick story, patient who fell off a horse. She unfortunately injured the nerves underneath her armpit. There are a whole host of nerves there that provide sensation and then motor function to the arm. They were injured, and she couldn't move the arm, and she was in horrific pain. And she decided several months later to have the arm amputated above the elbow. And unfortunately, so, that's cutting nerves, right? Because they cut all those nerves then underneath the armpit. And you'd think, well, gosh, if you cut the nerve, then the pain will go away.
That's right.
It seems intuitive.
Right. That was what my mother thought. Okay, in desperation, cut the damn thing here. Yeah. Right.
Exactly. Unfortunately, what happens is that you can, in this case, with her arm, you can develop what's called phantom pain. So she feels the arm as if the arm were there. And not only does she feel the arm, but she feels horrific burning, stabbing, shooting pain.
I think that's what my mother experienced. Yeah, exactly. All right, so cutting it isn't the answer, but blocking it, but a block just seems like a temporary for an hour or two a day. It seems like you'd have to block it all the time then.
Not really. You could block it, and patients can get several months of relief, and then you have to sort of block it again. You're talking about maybe epidurals. Epidurals are used for pregnancy, yes, labor and delivery, but we also use them to help treat chronic pain that might be shooting down the arms or shooting down the legs, especially in patients who've had spine surgery, by the way.
Yikes, okay.
And who have residual pain that might be shooting down the leg or arm.
So we can try and block the pain other ways other than giving you a pill. Because an opiate does what? How does an opiate take away pain? I know it's magic. I know everybody says it's euphoric when you take one of these things. Is it just tricking your brain into not recognizing the pain, or does it? I really don't even know how an opioid works, how it makes you feel happy here.
Well, a couple things. One is that it binds to these little receptors that we have in the spinal cord. And when it binds to, it's like lock and key. So when it binds to the lock, then it triggers a whole host of responses in the spinal cord to reduce and suppress pain. But you're right, it also goes to the brain. And, when it goes to the brain, it releases a substance called dopamine, which is sort of the pleasure substance. And it's that reinforcement of dopamine that can lead to abuse and addiction.
So is it just masking it then? The pain is still there, but it's masking it somehow? Or is it blocking it like a blocker?
But it does, I would say it does reduce the pain because it's using, we do this ourselves. Have you heard of endorphins? Those are sort of the endorphins are sort of like the internal morphine. Right. That we all use to reduce pain naturally.
You see something happy and your body gets flooded with endorphins. You go through a pleasurable experience and somehow your body produces this and you want to do more of it. Well, that makes me feel good to whatever.
But it also reduces pain. So if you, stub your toe, if you injure your knee, then our bodies naturally produce these substances that bind to these same receptors in the spinal cord and brain to reduce pain.
People go runners. I was a runner for a while, and the runner's high. All of a sudden, you're cranking out endorphins, and it's like not only you're more alert, but somehow you just feel happier just because you exercise to that level here. All right, so there's ways to block it. There's ways to mask it or to stimulate the happy feelings. Talk about these other crazy things you mentioned here. Are they using ultrasound or anything like that? Or are we zapping it with something here?
Right. So we have these, so you can actually use tiny doses of electricity, tiny doses of current, apply it to the spinal cord to block pain that transmits from the spinal cord to the brain. So think of it as like a heart pacemaker, right? You have a little box that powers wires that are in the heart to pace the heart.
Yeah.
Well, we can do something similar to the spinal cord to reduce pain.
And is it something like a little pacemaker that you implant and then it sends these little pulses out and that somehow blocks it or stimulates it or does something here? It creates an effect that reduces the pain somehow here?
Exactly. And it does. That's exactly what it does and can be very effective in certain people. Yeah.
Are there anything on the horizon coming? I just picture, we're Star Trek and they're going to wave a magic wand and, the pain is gone. I'm in every time in Star Trek, there's somebody's broken arm and they wave something magically and then the pain goes away. Isn't that what we're all hoping for? Wave a magic wand, a pulse, I don't know. Help me out here.
You're right. We all wish for that. I don't know if that's going to happen in our lifetime. I think that there are interesting and helpful things that are being studied on the horizon for pain control. One of them is actually the use of, so this is actually pretty relevant in terms of like the COVID vaccine. So we have these RNA vaccines that are being used.
Right, which we've talked at length about how that it tricks your little, if I understand it correctly, you guys can help me out, but if Dr. Trin explained it to me correctly, somehow you're not injecting like the old way where you'd inject a little bit of the disease in and your body would then trigger antibodies to fight that, and you've created a cascade of antibodies. Now you're sending the DNA into the cell and telling the cell is reacting to that DNA signal.
Yes, and what we're studying in the pain world is actually to do something similar to that, but place it in the spinal fluid. And actually, if you place it in the spinal fluid, it goes to the spinal cord, and in a fascinating way can change how we process pain and reduce it.
Wow. What are you seeing out there, Lanii? People are in pain with COVID. You're just testing them, but there must be side effects you're seeing. Hey, we're just here to test you. I know, but I'm depressed. I'm anxious. I'm upset. I'm fearful. I'm all this stuff. Well, go get some help. Next. Are you guys helping them in any way or advising them or reporting any of this data? Is anybody interested? Are there studies being done on COVID patients? Must be.
We are, yes. So we do have physicians that are on our board that helps out with this. A lot of them are internist and family physicians, but if they have a particular pain, for instance, or they're feeling depressed. You know, we have psychiatry, we have mental health that's able to help out with that. We do connect with other specialists, physicians, and we would connect those patients with those.
So my perception is, again, I'm going to be critical of Western medicine. Western medicine is target specific. It's fantastic if you need a heart replaced. It's incredible if you have a broken arm. But they don't tend to take a holistic view. You come in for this, I will do this. But I come in for COVID and I have all these other symptoms. Well, go see somebody else. I'm next. I'm an internist. I'm a specialist in this. I'm here to solve this. And if this is but rather than a more holistic approach, which I think is what my understanding, I'm not an expert on non-Western medicine, Chinese medicine, Indian medicine, Ayurveda or whatever it's called, they take a more holistic view. That's what the whole idea of, whether it's accurate or not, that they have this holistic view of how your body works, and that's why they're going to redirect energy and redo things and stuff. I don't know if I really buy all that and believe it, but I do understand a more holistic approach. Talk about that. Do we need a more holistic approach? I'll start with Dr. Christo here. Or are we just focused on that thing, that pain, that problem? I'm not going to look at the whole lifestyle and the whole body that may be causing this underlying condition.
I think that we are certainly in the pain world. We are, I think, embracing more integrative therapies, you know, than we did before. So that would be, as we talked about, you know, acupuncture, but it might be massage therapy too.
Right.
Pain psychology is helpful.
Right.
And so I feel like we are trying to study these to a greater extent to see how valuable they can be for people who are suffering from pain.
It's a whole mind-body connection here. You know, it's not enough just a broken arm is clear. I go set the bone and things will get better. But I have chronic back pain. I have other sorts of issues where pain is popping up all the place. Is it psychosomatic? Is it self-induced? Is it a physical thing that I can go in and tweak and fix? Broken nerve or something here. I mean, it seems like we don't really know. Pain is a mysterious. Pain can be anything. Sort of like when a baby cries. Does he want to be fed? Does he want to be changed? Does he want to be held? You know, we're just sort of guessing, it seems like, what the pain is indicative of. Am I overstating that?
A little bit. I mean, I think we know better than we did before about some of the mechanisms that surround acute pain and then chronic pain. They're complicated when it comes to chronic pain for sure, and we still have much that we don't understand in terms of chronic pain.
So pain's an indication there's a problem, and pain is an immediate wake-up call. I'm in pain. Help me. What would you say to people who are in pain today, Dr. Christo, other than go buy your book? I'm going to find out the other. Let's start by that and see if there are things we can do to gain here. In your radio show, in your regular work, and your appearances in shows like this, what's the message you want to leave people? Are we winning the battle against pain, or we still got a long way to go?
Well, number one, I would say don't give up, because I think I see a lot of people who feel like there's nothing to do, and they've seen multiple different healthcare providers, and they're just not helping them. So I'd say don't give up, though. Search for a pain specialist. We are trained in this area. There aren't a lot of us, unfortunately, but I would say seek out the services of a pain specialist. That would be number one. And then two, realize that there are treatments that can ease pain. It's not necessarily going to take it to a zero, right? I mean, and that's part of what we're discussing. I think the message is today. It's don't expect it to be a zero, but I have to say that, you know, even a 30% decrease in a lot of people that I see is very meaningful and helps restore a semblance of what they once had.
So what do you think, Lanii? What's the message from today for people who are listening in pain right now here?
I think it's great. It's tremendously helpful because I think a lot of the times when they're in pain, they don't think about anything else other than their pain, obviously, and they go for what's easiest and what's there and what's available. And I've experienced that even with before, you know, testing COVID. I worked in a nursing home facility, and that's the one thing I hear all the time is I'm in pain. Where's my physician? My medication is not fast enough. And let's say a patient's being transferred from the hospital, the acute, to the nursing facility. less than 1 hour, and our nurses obviously have to get the medication from the pharmacy. Still, the urgency of getting that pain into their system is just not fast enough.
If none of you listening have ever been to a nursing facility, go visit one sometime. What an eye-opener that was. My late mother, my late father, my late aunt, all went through this. Awful to see. None of us want to end up in these facilities for obvious reasons. And I'll never forget the one story, the one I saw when my mother was in one of these last facilities before she died. There was a man down the hall, and all he did is all day long say, "Help me, help me." And of course, nobody helped him because they had just tuned him out. I can't help him. So they just let him wail until he would get hoarse. And then he'd start up again, "Help me, help me." And I don't know if it was a mental issue or if he was really in pain, and everybody after a while just ignored it and said, "Just shut up. Don't do it." I think too many people in pain are being told, "Just shut up." So that's the opposite. I understand we can go to zero, but we also have a lot of people that they're just kind of shrugging and going, "What do you want me to do?" And I want you to get rid of the pain. So somewhere between those extremes of I got a little bit of pain, get it away, I can't take it for 2 seconds, and I'm in chronic pain, and I shrug, and and they go, "I don't know, go see somebody else, I give up." Talk about that, Dr. Christo, where those two extremes seem to be fueling the problem. Solve every pain, can't solve your pain at all.
Yeah.
Yes, and those extremes certainly do exist. And, this is why I think a consultation with someone who specializes in pain is helpful, because we're used to describing what to expect and what we can do. It may be more traditional medications, it may be some injection therapies, but it may be something innovative like we've talked about. It may be a pain pump, it may be a stimulator device, something that can help better control the pain.
How do we find these people? Are there specializations? How do I know? I can go see if somebody's board certified in a million things. Are there board certified pain specialists? Because there's a lot of quacks out there too. I'm sorry, guys. My mother saw half of them. And people who promise to shake a magic voodoo wand and do something crazy or cut her nerve or anything. I mean, she was so desperate. My dad was so desperate. They would listen to anybody. It was like the old days of going to see a medium. Somebody died and you want to talk to a loved one who's crossed over, and you go to any seance, any medium, any hope that you have. And there are tons of charlatans. I'm sorry, and fake. That's my perception of fakes, and charlatans are people who half-baked ideas, and people are being, because they're desperate. So how do I find the real from the fake?
Well, number one, you can go to the American Academy of Pain Medicine website, and there it will list, there's a database there of specialists across the country, and I think that's a good way to access to determine if there's someone that's close to you or not.
Okay.
You can access a pain specialist, that is.
So are there certifications for this? Are there board certified pain specialists, or is that yet to come?
There are. Usually the process is, so it's medical school training, and then there's training after that, which is called a residency for me, it was anesthesiology. And then there's additional training that was a year after the anesthesiology training that focused on pain medicine. And so you're looking for someone who's done additional specialty training in pain medicine.
What attracted you?
But that's not to say, one thing there, it's not to say that, there are other practitioners can't be helpful who aren't trained. That is in pain medicine. We talked about acupuncturists, right? I mean, they have their own specialty training. Very, very powerful, can be extremely helpful.
Yeah. Well, and we're beginning to realize there are more ways than just taking a pill. And we've talked about some of them today, from non-traditional or traditional things. As Lanii was talking about, as my mother went through, I mean, I don't know why, I don't know how acupuncture really works. Have we figured out why acupuncture really works? Is there really a meridian of forces in your body that you can redirect? Because it is kind of, you're talking about electrical impulses. It somehow seems, I can't really explain it, but that seems to be sort of the fundamental premise, that there is some sort of energy or electrical force transferring through your body, and that we can divert it or get around blockages and other things. Have we figured out why acupuncture does work, if it does?
What you described is in part true. Yes, I think you are accessing these meridians, and I think there are energy fields in the body. I mean, I may be
you're going to get drummed out of this core here now. Come on. Yeah, right.
But I think there are. I mean, there's a human aura that exists, and I think that tapping into that can help ease pain. It can help restore blockages, as you talked about, sort of energy blockages.
Yeah.
And we have studied acupuncture in terms of its ability also to release endorphins, by the way.
See, look at that. Put a little pins in there at the right place and things happen. How about CBD? Dr. Trin's a big believer in CBD, anti-inflammatory capabilities, characteristics, and so often, as he says, inflammation is just a sign of something bad going on here. So if you can reduce the inflammation, you might not get to the core problem, but if you can reduce the inflammation, you substantially reduce problems like Alzheimer's or other sorts of things. All of these things at some level are inflammation of the brain or the body or something here.
I think that medical cannabis has a lot of potential. I feel like, unfortunately, if you look at a lot of the research on it, it's not quite as helpful for pain as we would like. And we don't exactly know how to use it. That is it best smoked? Is it best vaporized? Is it best applied topically? Right. What dose? How frequently? And should it be a mixture of, say, THC and CBD? So from the medical standpoint, I think there are a lot of unanswered questions scientifically. On the other hand, I do have patients who benefit from it.
There you go. All right. Well, after today's show, I may be tempted to go smoke something here just to escape my own. It's a depressing topic for many of us here. It has the implication of, I don't have all the answers. I want an answer right now, and I lose hope. I lose belief. But if there's any belief you can get out of today, there's a book you can go get. Where do they go get the book? On Amazon, bookstores, anywhere? Give us again.
Yes, Amazon. Aches and Gains. Right, Amazon would be great.
Aches and Gains. A website. Is there anything else they can go if they want to follow up and learn more about you, doctor, or communicate or learn about your radio show or your work or anything here? Any place they can go?
Sure. They can go to paulchristomd.com, and that's my website, and that has all of the radio shows that I've done for actually since 2011. So there are a lot of resources on that website.
And Christo is spelled?
Christo.
Okay. All right. And Lanii, are you a nurse, or you're not a doctor, or maybe you are a doctor?
No, I started off as a medical assistant.
Okay. So how do they learn more about your clinic and the work you're doing to test COVID? Which was for a long time the big problem. Nobody could get a test. Now we're moving beyond that.
It's available everywhere.
Yeah, they're available everywhere.
Right.
So tell us about your work and your clinic here.
So I'm currently, I'm not using my medical assistant license. I am the VP of Community Health. So a lot of the outreach of the community, more so for the seniors, since that's where my expertise came from, working in a nursing home facility since 2005. But we're known for our super sites, more so of, these are drive-throughs, super sites in OC Fairgrounds. This is in Orange County, and Anaheim Convention Center. However, we've expanded and grew rapidly. So we are now pretty much, our motto is pretty much going to you on site to boarding cares, assistant living.
There you go. Take the testing to you, right? Well, that's a topic for another day to have you come back and talk about the future of testing. Is that business going to evaporate as the bug goes away, as we hope it will, or is the bug here to stay and we're going to be testing for years to come, testing and retesting and whatnot? I'll leave that for a tease for a future show here. But I want to thank you both for coming. I want to thank everybody for tuning in this morning here.
I'm
sorry if I sort of dominated the conversation, but it's a topic near and dear to me because I saw those near and dear to me, like my mom, my dad, my aunt, spend many, many years in pain. And pain just seems to be one of those persistent things for which we think there's either an easy, immediate answer or there's no answer. And I hear somewhere in between is probably the truth. So thank you all for coming on here today and for joining us here on this version of Health Talks with Dr. Trin. Thanks, guys.
Thank you.
Thank you.
You've been listening to another great example of Health Talks with Dr. Trin, the one reason, maybe the only reason you should tune in every Thursday and bring your questions. We'll see if we can find out some real answers for you. Right here in Orange County's only community radio station, octalkradio.net.